Hello students. Now, what are the drugs we generally used as non-selective anti-inflammatory? The first class is non-selective COX inhibitors. In this class, aspirin is a drug. It is a acetyl salicylic acid converts to salicylic acid in body, and salicylic acid is a simple organic acid. Now, the mechanism of action. The analgesic action is mainly due to upturning of peripheral pain receptors and prevention of prostaglandin mediated sensitization of nerve ending. Aspirin resets the hypothalamic thermostat and rapidly reduces fever by promoting heat loss but does not decrease heat production process. Anti-inflammatory action is exerted at high doses like 3 to 6 gram per day or 100 mg per kg per day. Now, there are some adverse reaction or adverse effect enlisted. Um, Main adverse, commonly the side effects are enlisted here. You can see and the severe nausea, vomiting or stomach pain. Um, The antithrombotic doses are gastric upset and gastric and duodenal ulcers also may can produce, and several type of hepatotoxicities, asthma, rashes, GI bleeding, and renal toxicity rarely even occur at antithrombotic dose. Now, what are the use or what are the clinical use of aspirin? It is used as analgesic like 300 to 600 milligram during 6 to 8 hours for headache, back pain, pulled muscle, toothache, and neuralgias. As antipyretic in fever of any origin in the same doses as for analgesics are can be used. However, paracetamol and metamizole are safer and generally preferred. Acute rheumatic fever. Aspirin is the first during choice of drugs. Other drugs substitute aspirin only when it fails or in severe cases. Uh, Rheumatoid arthritis is the another um, platform to use of aspirin as a dose 3 to 5 gram per day after meal only. It is effective in most cases since large dose of aspirin are poorly tolerable for a long time. The new NSAIDs in like diclofenac, ibuprofen, etc. is depot from the form of preferred. Now you can see others uses are there like it is the first choice of drug in case of acute rheumatic fever, which I have told. Now the second category drug is preferential COX-2 inhibitors. Nimesulide, it has been used for the primary short-lasting painful inflammation like condition like sports injuries or any other kind of sudden pain related um, situation. Now, what are the mechanism of action of this drug? It uh, act as anti-inflammatory action may be exerted by other mechanism as well. Example, reduced generation of superoxide by neutrophils, inhibits PAF synthesis, and PAF, it means personal action form, and the synthesis of TNF, uh, which is uh, called tumor necrosis factor release, and free radical scavenging, inhibition of metalloproteinase activity in cartilage. The analgesic and antipyretic and anti-inflammatory activity of nimesulide has been rated comparable to other NSAIDs. Now you can see what are the adverse effects are enlisted here. Gastrointestinal disorientation like gastric problem, heartburn, and sometimes nausea, loose motions are here. Then dermatological problems are adverse effect of this kind of drugs like rash and central nervous system problems like dizziness, drowsiness are there. So what are the clinical uses of nimesulide? It at first we have just read here that it may be used in case of sudden injuries, sport injuries or pains, and except from them it can be also used in ear, nose, throat irritation or disorders, dental surgery, low backache, and post-operative pain, arthritis, rheumatoid arthritis, osteoarthritis, and for fever also. Now, here also enlisted two other groups. One is selective COX-2 inhibitors and another is analgesic antipyretic with poor anti-inflammatory action. So, what are the function of selective COX-2 inhibitors? It exerts anti-inflammatory action or analgesic actions and antipyretic actions with low um, ulcerogenic potentials. It is comparative trials in rheumatoid arthritis have been found to be effective as naproxen or diclofenac without affecting COX-1 activity in gastroduodenal mucous layer. The platelet aggregation in response to collagen exposure remained intact in celecoxib recipient and serum thromboxane B2 level were not reduced. Through tolerability of celecoxib is better than traditional NSAIDs. Still, abdominal pain, dyspepsia, are mild diarrhea are common side effects of these drugs. Rashes, edema, and small rise in BP have also been noted. Celecoxib is slowly absorbed, 97% plasma protein bound, and metabolized primarily by um, cytochrome P with a T half of 10 hours. It is approved for use in osteo and rheumatoid arthritis in dose 100 to 200 milligram. Now, what are the action of analgesic antipyretic with poor anti-inflammatory action? In this type of or in this category's drug is paracetamol. The central analgesic action of paracetamol is like aspirin. Example, it raises pain threshold. It is poor inhibitor of prostaglandin synthesis in peripheral tissue, but more active on COX in the brain. It is a poor inhibitor of prostaglandin. Um, it is a good promptly acting antipyretic, but negligible anti-inflammatory action. The analgesic action of aspirin and paracetamol is additive, well tolerable orally, but only about one-fourth is protein bound. It is uniformly distributed in the body. Metabolism occurs mainly by conjugation of glucuronic acid and sulfate. The plasma T half is 2 to 3 hours, effective after the oral dose lasts for 3 to 5 hours. The clinical uses are one of the most commonly OTC drug or over-the-counter drug for analgesic. It is used mainly for the headache, migraine, musculoskeletal pain, um, dysmenorrhea, but it is relatively ineffective when inflammation is prominent. And antibiotic also you can use. The adverse effect of this paracetamol, I mean, generally it is safe and well tolerable drug, but sometimes nausea, rashes occurs. Analgesic nephropathy, acute paracetamol poisoning also there, especially in case of small children who have low hepatic glucuronic conjugating ability. If it is taken a large dose, like greater than 150 milligram per kg or 10 milligram in an adult, it may be serious toxicity.